Healthcare is not a privilege. It is not something disabled people, older adults, children, caregivers, and low-income families should have to earn through paperwork. But across America, Medicaid changes and funding cuts are putting people's health, independence, and lives at risk. Hey, it's Brandon, your one-legged disabled self-advocate. Have you ever had issues with Medicare or Medicaid? Maybe you got a confusing letter, had trouble getting a service covered, dealt with too much paperwork, or worried about losing the care you depend on. Today, we need to talk about Medicare, Medicaid, and why the changes happening across the country matter to all of us. A missed letter should not mean losing your doctor. A confusing form should not mean losing your medication. An inaccessible website should not mean losing the services that help you live independently. But for many people, that is exactly what more Medicaid paperwork and cuts can lead to. Medicare and Medicaid are not the same thing. Medicare is federal health insurance. It is mainly for people age 65 and older, along with many disabled people. Medicaid is health coverage for people with low incomes. It is funded by both the federal government and the states. Every state may call it something different, but Medicaid helps people get the care they need. Medicaid can cover doctor visits, prescriptions, hospital care, mental health care, disability services, home care, and long-term supports that help people stay in their homes instead of being forced into institutions. For disabled people, Medicaid is often not just health insurance. It can mean having a personal care worker. It can mean getting therapies, medical equipment, transportation to appointments, or support to live in the community. It can mean the difference between independence and being forced to go without care. And many people have both Medicare and Medicaid. Medicaid can help them afford Medicare premiums, deductibles, co-pays, and services Medicare may not fully cover. New federal Medicaid rules are bringing more reporting requirements and more barriers. Starting in 2027 in most states, some adults may have to prove every month that they worked, attended school, completed job training, or volunteered for 80 hours. Some people are exempt, including many people with disabilities, people on SSI, people who have both Medicare and Medicaid, caregivers, pregnant people, and others. But here is the problem. An exemption does not protect someone if they do not know they qualify, cannot get the paperwork, or the system makes a mistake. Let's be honest, this is not simply about whether someone works. Many people on Medicaid already work, go to school, care for family members, manage disabilities, or are trying to survive serious health conditions. The real issue is whether people can keep up with more forms, more deadlines, more phone calls, more online reporting, and more proof. Disabled people already face barriers every day. Inaccessible websites, transportation problems, difficulty getting documents, long wait times, and notices that are confusing or never arrive. No one should lose healthcare because they could not get through a broken system. Comment below if you have concerns about the current administration's actions on Medicare and Medicaid, or comment something random to help this video reach more people. Please share, comment, like, and subscribe. This is a nationwide issue. The details may look different depending on your state. One state may send notices differently. Another may have different deadlines or systems for reporting. But the danger is the same everywhere. People can lose coverage, not because they no longer need health care, but because the system made it too hard to keep it. Disabled people should not have to fight for the right to see a doctor, get medication, live in their own home, or stay alive. Here is what you can do right now. Keep your address, phone number, email, and online Medicaid account updated. Open every letter or notice from your state Medicaid program. Save copies of medical records, disability letters, benefit notices, and anything that shows you may qualify for an exemption. If you get a notice that does not make sense, ask for help from a disability rights organization, legal aid office, benefits counselor, or trusted advocate, and contact your elected officials. Tell them that Medicaid is not waste. It is healthcare. It is independence. It is survival. Disabled people are not numbers on a spreadsheet. We are people. We have families, goals, communities, and lives that matter. Healthcare should not disappear because someone missed a deadline, could not access a website, or could not prove their disability fast enough. Protect Medicare. Protect Medicaid. Protect disabled people's right to live with dignity and independence. Our lives are not a budget cut.